If one of your teeth suddenly looks longer than the tooth beside it, the tooth probably didn't grow. Your gum line may have moved, and gum recession usually starts slowly enough that people don't notice until the root is already becoming exposed. That matters more than it sounds. The root surface isn't covered by enamel the way the crown of your tooth is, so once it's exposed, that part of the tooth is more vulnerable to decay and often more sensitive.
There are 7 clues worth watching for. The first 4 you can check in a mirror tonight, then I'll show you what actually causes this.
Start by comparing the gum line around similar teeth. If one tooth suddenly looks noticeably longer, or the gum line sits lower than the tooth beside it, that's our first clue. Go slowly. You're not looking for something dramatic. You're looking for one tooth that doesn't match its neighbors. Good light helps, and so does comparing the same tooth on the other side of your mouth, since those two should roughly mirror each other. The second clue is what you find when you look a little closer at that spot. Where the gum has pulled back, you may be able to see part of the root, and it usually doesn't look like the rest of the tooth. It tends to be slightly darker, more yellow than white, and less glossy. Some people can also feel a small notch or step with a fingernail right where the gum line used to sit. Here's why that difference exists, and it matters for the rest of this video. The crown of your tooth, the part you normally see, is covered in enamel. Enamel is the hardest tissue in your body. The root isn't covered in enamel. It's covered by something softer. So when the root becomes exposed, that surface simply doesn't have the same protection. That's why decay can develop more easily there, and why it tends to move faster once it starts. The third clue is sensitivity, but a specific kind. Cold water, a cold drink, sometimes something sweet. And it's not your whole mouth reacting. It's one spot, near the gum line, and it wasn't doing that a year ago. That combination is what matters. New, localized, near the gum. Now, I want to be careful here, because this one gets over-read. Not every sensitive tooth means recession. Sensitivity has several possible causes: a cracked filling, a cavity, grinding, or something else entirely. Plenty of people have sensitive teeth and perfectly normal gum lines. What makes it worth paying attention to is the pattern. If a tooth that never bothered you starts reacting to cold, and it's reacting right at the gum line, and that same tooth looks a little longer than it used to, now you have 2 clues pointing the same direction. That's different from sensitivity on its own. The fourth clue is discomfort when you brush or floss near the gum line. Not the general soreness of a mouth that hasn't been cleaned in a while. Something more specific, one area that's tender when the brush passes over it, or a spot that consistently feels raw after flossing. And this clue is different from the first 3 because it sits right on the line between a symptom and a cause. Here's what I mean. If a spot is tender when you brush it, one possibility is that recession has already exposed a sensitive surface there. But another possibility is that the way you're brushing is contributing to what's happening at that spot in the first place. Those two aren't mutually exclusive. They can be feeding each other, which is exactly where we need to go next, because you've now got 4 things you can check yourself. And the obvious question is why any of this happens at all. So, why does this happen? The first one is the one you can change today. How hard you brush. And I want to be accurate about this. Researchers haven't actually settled whether hard brushing causes recession on its own. A systematic review looking at exactly that question came back inconclusive. What is clear is that heavy pressure and stiff bristles wear away the tooth surface right at the gum line, and that brushing harder doesn't clean better. So whether or not it started the recession, it's doing damage in exactly the spot where recession shows up. Second, plaque and gum disease. When plaque and tartar build up along the gum line, the tissue becomes inflamed, and if that continues, The disease process itself can destroy gum tissue and the bone underneath. Third, tobacco. This one isn't ambiguous. Tobacco use is described as the single most significant risk factor for gum disease, and smokers show more recession than non-smokers. Fourth, things you didn't choose. Some people have naturally thin gum tissue. Some teeth sit slightly outside the arch, with less tissue covering them to begin with. Injury and grinding can contribute too. And a word about age. Recession does become more common with age. By one estimate, around 88% of people over 65 have it on at least one tooth. But common is not the same as harmless, and it shouldn't automatically be dismissed as normal aging. Several local and behavioral factors can contribute, and those are the ones worth looking at. Now let's get to the 3 clues that need someone else's eyes, not just yours. Number 5 is bleeding, redness, or swelling. And I need to be precise about this one because it gets confused constantly. These are signs of gum inflammation, and inflammation is not the same thing as recession. They often show up together, but bleeding gums on their own don't tell you the gum line has moved. What they do tell you is that something is going on that needs attention. Healthy gums generally don't bleed when you brush them properly, so if yours do, routinely, not once, that's worth reporting, whether or not there's any recession involved. Think of it as a separate signal that happens to travel in the same company. The 6th clue is changes in the spaces between your teeth. New gaps where there weren't any. Food packing into the same spot every time you eat. Root surfaces visible in the triangle between 2 teeth. A gum line whose shape has changed. Uneven in places it used to be smooth. These are worth noticing because they're often the first thing people actually complain about. Nobody comes in saying their gum line contour has changed. They come in saying the same piece of food gets stuck in the same place every single day, and they're tired of it. That daily annoyance is information. It usually means the space between 2 teeth has changed shape, and that change didn't happen overnight. And here's my one rule for this clue. You cannot diagnose what's underneath by looking. There's a lot of talk about measuring gum pockets and what different depths mean. That's a measurement a dental professional takes with an instrument. It is not something you can assess in a mirror, and trying to will only worry you or falsely reassure you. The 7th clue is a tooth that feels loose, or a bite that suddenly feels different. This last one is different from the others, and I want to be precise about it. A loose tooth or a bite that suddenly feels different isn't really a sign of recession itself. It's a sign that the structures underneath, the bone and the attachment holding that tooth, may be affected. Those 2 things often show up in the same mouth, which is why it belongs on this list. But it's a more serious finding, and it's the one that should get you to a dentist soonest. So if you notice a tooth moving under light pressure from your tongue, or your teeth meeting differently than they used to, don't wait to see whether it settles. That's the one clue on this list where time matters. The 7th clue is a tooth that feels loose, or a bite that suddenly feels different. This last one is different from the others, and I want to be precise about it. A loose tooth or a bite that suddenly feels different isn't really a sign of recession itself. It's a sign that the structures underneath, the bone, and the attachment holding that tooth may be affected. Those 2 things often show up in the same mouth, which is why it belongs on this list. But it's a more serious finding, and it's the one that should get you to a dentist soonest. So if you notice a tooth moving under light pressure from your tongue, or your teeth meeting differently than they used to, don't wait to see whether it settles. That's the one clue on this list where time matters. So you've got 7 clues. What do you do with them? Not diagnose. Prioritize. Here's how I'd think about it. If it's one tooth, one that looks longer, one spot that's newly sensitive, that's a localized change. It's worth mentioning at your next appointment, and worth looking at how you're brushing that particular area. If it's spread across your mouth, redness and bleeding in several places, along with gum lines that have moved, that's a different picture. It may suggest something affecting the whole mouth rather than one spot, and that shouldn't wait for a routine checkup. And if there's looseness or a changed bite, that goes to the top regardless of what else you've noticed. And to be clear, none of this is you diagnosing yourself in a bathroom mirror. The point of noticing is not to name the problem. It's to notice early enough that someone qualified can. If you want more clear, evidence-aware health explanations like this one after 60, subscribe. That's what this channel is for. Here's the part that matters most, and I'm going to say it plainly. Gum tissue that has already receded does not simply grow back on its own. What treatment can often do is stop it from getting worse, manage the sensitivity, and protect the exposed surface. In some cases, a dentist can surgically restore coverage. But that's a procedure, not something that happens from a rinse, so the goal is protection, not reversal. Here's what that looks like. Pressure first. Hold your toothbrush the way you'd hold a pen, not the way you'd hold a hammer. If your bristles are splaying outward after a few weeks, you're pushing too hard. Use a soft bristled brush. Soft, not medium. Change the motion. Small, gentle movements angled toward the gum line, not a hard horizontal scrub back and forth. Keep plaque under control, consistently. That's what protects the tissue you still have. Get examined. A professional can tell you whether what you're seeing is stable or progressing, and that distinction matters more than how it looks. If gum disease is present, treating it is the priority. If sensitivity is the main issue, there are fluoride and desensitizing treatments. And where it's clinically appropriate, grafting can restore coverage over an exposed root. One question I know is coming. You'll see a lot of content promising that a particular oil, a salt rinse, or a homemade mixture will grow gum tissue back. The honest answer is that receded tissue doesn't regenerate that way. Good home habits matter. They're how you protect what you still have and keep the problem from progressing. That's a real and worthwhile job. It just isn't regrowth. Longer-looking teeth, exposed roots, and new sensitivity are clues worth noticing. But the goal isn't to diagnose yourself in a mirror. It's to recognize changes early enough to ask what's causing them. One clue is an observation. Several together is a reason to make an appointment.
And if your gums feel irritated even though you brush every day, the next thing to look at is what you're putting in your mouth during that routine.